All right, let's take a look at the cardiac cycle. So there are two main phases or two main things that happen during the cardiac cycle, and those are diastole and systole. So diastole refers to the relaxation of the chambers of the heart. Systole refers to the contraction of the chambers of the heart. Now, mainly or most of the time when we are talking about diastole and systole and we are measuring the pressure within the heart, we're mainly going to be referring to the pressure that's found in the ventricles rather than the atria, because the ventricles are the discharge chambers, so they're going to be putting a lot more pressure. And when we use diastole and systole as numbers to measure blood pressure, which we'll talk about later, we're really talking about the pressure that is found in those ventricles of the heart rather than the atria. But the atria can also undergo diastole and systole. They can relax and contract as well. And so you'll see both of those things happening in this cardiac cycle here. So let's start at the very top in phase 1. This is where we are seeing diastole in both the atria and the ventricles. So at this point, all four chambers in the heart are relaxed, and blood is freely entering into the atria and then passing from the atria down into the ventricles. Now, once the blood starts passing from the atria down into the ventricles, at the end of atrial diastole, the atria will then enter into systole, which is where they will contract to push any remaining blood down into those ventricles to make sure that the ventricles are fully filled up with blood right before they get ready to discharge that blood out of the heart. And so during this phase, we still see diastole of the ventricles. They're still going to be relaxed, but at this point, the atria are going to be in systole. They're going to be contracting to push blood down into the ventricles. Now, once the ventricles are fully filled up with this blood, at that point, we will see ventricular systole. And this is when the ventricles will contract to push that blood up and out of the heart along the aorta and the pulmonary trunk. And so pressure will build up inside of these chambers during ventricular systole. At this point, the atria will relax, right? So they are in atrial diastole, and they're going to begin filling back up with blood once we have pushed this blood out of these ventricles. So during ventricular systole, again, the blood is leaving the heart, and you can see that the atria are already refilling. So they're in diastole, they're already starting to refill, and then by the end of ventricular systole, everything kind of goes back to the way that it was before. So all four chambers at this point will be relaxed. You will see all four chambers in diastole, and you will see blood returning to the heart and getting ready to pass from the atria down into the ventricles, where we can start this full cardiac cycle over.